Oh, my smile was horrible. My smile was really horrible. It's always been horrible since school, but I just never got it fixed. And then as I got older, I thought it's just something I've got to do now because I really hated my teeth, and I mean hated them.
So the first time I met Chelsea, she'd already been to the practice several times, and she'd already spoken to our practice manager and our orthodontic therapist. Because she was extremely nervous, meeting me, the clinician, for the first time, she was very reluctant and apprehensive.
I actually went for braces when I was about 12 in school because my teeth were really bad and I did get bullied quite badly for them. So I went for braces, but I actually fell quite ill, and I had a jaw brace and I couldn't keep it in my mouth. So I ended up not having the brace treatment, and then I couldn't get it done again. So I had to wait. And then as I've got older, I thought, I just hate them. Like, I've always hated them, I've always been bullied for them, like my confidence, like I'd never smile or anything.
People like Chelsea who are extremely nervous, maybe dental phobic, and have often had some very traumatic past experiences when it comes to having dental treatment.
Like when I used to walk down the street, I'd make sure that my mouth was closed because I was so I always thought, oh, someone can see them, people are looking at them, everyone around. And I was like really, really unconfident. And I can't breathe that well through my nose, so it caused all loads of problems.
It's extremely important to start slowly and build their confidence gradually to obtain that trust, but also show our caring nature. And that dentistry has come on, and no two individuals are the same.
You need, I think, when you go for braces, it's so uncomfortable, you need to be comfortable because it's not the most pain-free thing to go through.
So one of the most important things with regards to dental treatment, and any orthodontic treatment in particular, is to be completely open and honest and manage one's expectations in terms of how we can improve their smile, but also realistically what can be achieved as well. And this was extremely important in Chelsea's treatment. So
I came in for my appointment. It was actually Pri and Dominica there. And it was just comfortable from the start. I sat down and it went through lengthening, because there's loads of different types of treatment I could have had. And obviously I was quite conscious about having a silver brace across the front because I work and I just didn't really want the whole big train track thing. So we went on and we did all the procedures and stuff, and it just, I felt comfortable the whole time. I was sure then after my first appointment that I was going to go with Signature, just for pure comfort. Like, it was just always at ease sat there.
The treatment option that we eventually agreed with Chelsea, and which she was very keen on, was to have upper and lower fixed braces. But she was really adamant that she didn't want to have teeth taken out, and certainly not jaw surgery, due to her past dental phobia and anxiety, but also in terms of the time period that it might take as well. And this is fine, this is respected. And so we were open and honest about what we thought we could achieve in the time frame. And we agreed with Chelsea that we would make a realistic, quite a notable improvement, but there might be one or two limited outcomes at the end of treatment, with her not going for the full complex treatment options available to her. Now, this doesn't mean by any chance that the treatment's going to be inferior, as you'll see with regards to Chelsea's outcome, but it would mean that we would need a lot of dedication on Chelsea's part to look after her braces, look after her diet, look after her brushing, but also for her to do the things that are very necessary from our point of view to get the best outcome from her. So there was a little bit of work that she needed to do at separate times or separate stages in the treatment, such as wearing elastic bands. And in actual fact, we found she was excellent with this request, and this is reflected in the outcome that we got for her.
Because I think I've always wanted braces, and I've always wanted nicer teeth, and I see people like smiling on pictures and stuff, and oh, I wish I could smile on the picture, which I couldn't. Like, it was always like a very closed mouth one. And then the outcome, I was nervous that, like, what if I didn't get the outcome that I wanted?
So the time came when we were ready to schedule the braces off appointment, and we were all very excited and all a little bit nervous as well. But Chelsea was really keen to get these braces off and see her teeth without the braces in place for the first time in a long time.
In my head, I just couldn't get away from the picture of what there was before, and then as soon as I seen them, like, I was in shock. They were way better than I thought.
The appointment itself went without a hitch, and to see her teeth for the first time after several months with the braces in place, she was absolutely over the moon, and as were we. And you can really see that in all the photographs that we've taken, and all the photographs that Chelsea's taken of herself since then as well.
It makes you so much more confident. I mean, in your aspects of life, it's funny that someone can literally just change your whole life, like just getting braces as something as little as that. And it sounds, but to some people it sounds massive, doesn't it? But it changes your whole life, job aspects, confidence. Like when you go out, like when I go out on a night out with my friends, I don't feel like, oh, they all look really good. You know what I mean? It's just funny that one person can just change the whole of it.
So I'm a firm believer in that if you empower people themselves whilst they're having this treatment, and you arm them with all the information that they're looking for, not necessarily the information you want to give from a technical aspect, but certainly the information that they would like to know from a lay perspective, and relate that to other people who've had treatment. It's extremely important. And if you have the track record, and also if you have a good chairside manner, helped by your team, then you can do wonderful things for patients, and you can dramatically change not just somebody's teeth or their smile, but their whole outlook and personality. And Chelsea was a great example of this. She really came out of her shell. She went from somebody who was quite introverted and embarrassed to somebody who's extremely vivacious, extremely photogenic, and has just been an absolute joy to treat.
I can't stop smiling.